At a recent press conference, Minister of Public Health, in giving some news of relief, told reporters that there has not been any confirmed cases of the virus that is associated with the recent spate of deaths in a number of countries. Chief Medical Officer Dr. Shamdir Prasad noted that surveillance at various ports of entry has already been instituted.
All of our points of entry, we're not just saying official ports, the points of entry, we have strengthened the surveillance activities and the screening that the persons who were traveling from areas where we know this virus was identified and as flagged by WHO.
The CMO noted that the ministry has also commenced sensitization at various private and public health facilities on the high index of suspicion. Nightly News understands that the Georgetown Public Hospital has already identified isolation areas at the institution, which will be used to ensure the safety of the public and patients who visit the hospital for other illnesses. The World Health Organization did not recommend travel restrictions for countries. A team from the Ministry of Public Health briefed Cabinet on Tuesday on the country's preparedness to deal with cases of the disease. So far, the Georgetown Public Hospital and the Diamond Diagnostic Center have been identified as the two medical facilities where arriving passengers showing symptoms of the disease will be kept. The public health minister said that the ministry will now move on to the second phase towards full preparation in the event of such incidences.
We have not moved to the second phase, which is to look at whether we do have cases, and we have cases that are in the first stage, and if we need to isolate, then what are the numbers we're talking about? So we're now going back to the drawing board, and we are going to look at what it will take to expand the services outside of Georgetown.
Some of the common human symptoms for coronavirus include runny nose, headache, cough, sore throat, and fever. The incubation period for the disease is 14 days. Training for medical personnel was slated to begin on Wednesday. Tamika Rodney reporting for HGP Nightly News.